Now, figures obtained by BBC Breakfast suggest the government will fail to reach its target to give patients in England access to their online medical records by April of next year.
Only 3% of GP surgeries have opened their files, as Graham Satchell reports.
Nicola has a range of complicated medical conditions and is being treated at 5 different hospitals. She's happy with her care, but has a familiar complaint.
My main problem is the communication. One department doesn't talk to another department. I do find it tremendously frustrating, and especially when I've had that same conversation with one hospital and I then have to repeat it all with another hospital.
Hello Ingrid, would you like to come through?
Some parts of the NHS have now embraced digital technology to help join up communications. At this GP surgery, patients are encouraged to access their medical records online.
They are absolutely gobsmacked that they can do this. They didn't know that this sort of technology existed. It's completely transformative for the patients.
I've seen this, it's really good.
It's brilliant, isn't it?
Yeah.
Ingrid also has a range of medical conditions. Her records, a complex web of test results, letters, prescriptions, x-rays. Being able to look at them at home has changed Ingrid's relationship with her GP, made her more aware of her condition, her treatments, and helped in simple ways, like remembering what's said in a consultation.
You come out and you think, what did they say? But if you can be at home and you can read the letter, go through it in your own time, make sure you understand it, the potential is amazing, and not just how it sounds when somebody says, would you like to have access to your records?
But despite the benefits to some patients, only a tiny fraction of GPs have actually opened up their records, 3%. Still, the government has a target for everyone in the NHS in England to be able to access their records online by April next year. Will the government meet its target?
No, it won't meet its target, and it will fail for a variety of reasons.
The main worry for GPs is security and the risk sensitive information will be hacked. But opening up medical records would, they say, also change what doctors feel they can actually write.
Would you want to see a note from me in your record saying could be cancer? You probably wouldn't. I'm going to have to suddenly change the way in which I construct that record, and that may change the way in which I'm able to look after my patients.
NHS England say they hope to meet next year's target and are working with GPs to make it happen. But many, like Nicola, remain frustrated. She firmly believes being able to see her records would improve her knowledge, help coordination and lead to better care. Graham Satchell, BBC News.
Well, let's go to Graham now, who's with us. Graham, it's a really interesting subject, and a lot of people thinking at home, would it be valuable or not, what information is there? In that question about what the GPs think, they're worried, aren't they? Because they write possibly for their own purposes and not for the eyes of their patients.
That's exactly. They're worried about two things primarily, I think. Security, so the risk that the information will get out in some way or be hacked. But I think the second point is the key one for them, because the record, obviously it's your record and it's my record, but it's also an invaluable tool for them, an aid memoir, so that as soon as they bring it up, they've got that person straight away. And at the moment they feel as though they've got total freedom to write absolutely anything in that record because it's for them. Now, if you start accessing that at home and you see things like, I don't know, like the doctor said there, it could be cancer. Now, he doesn't know yet. And he doesn't want to tell you until he is a bit more sure about it, but it's still important for him. So those are difficulties, I think, for GPs who've got a sort of a cultural problem with this, some of them. NHS England say they're talking to the British Medical Association about that, and there are discussions going on, and they're confident that they will meet this target of April next year, even though only 3% of doctors are doing it. And I think what's interesting is you talk to people who are doing it, who do have access to their records, and they say it's totally transformed the way they look at their conditions, their relationship with the hospitals and GPs, and for them it does work. And if you're interested in doing it, then the first port of call is to talk to your GP. You have to talk to your GP about this.
I'm sure people will do, Graham. Thank you very much.
7:22 the time now.